Welcome to the daily briefing here at the St. Clair County EMA office, where once again we're joined with Chairman Mark Kern and Sam Bierman from the St. Clair County Health Department. And as always, Sam is the burden of some bad news today.
Well, I don't know that I like being known as that, but unfortunately the numbers have continued to rise. And as we have done in days past, the numbers that we will be reporting to you today are for St. Clair County residents that have currently been tested. And as of today, we are at 2,705 that have been tested, with 621 positive test results, which includes 28 new positive test results, and that is both males and females from under 10 to their 70s. We are currently at 2,039 negative test results, with 45 still pending. We are at 53 deaths today, so we do have some sad news to report. We are adding 2 additional deaths. The first, a male in his 70s who did have underlying health conditions, and the second, a male in his 50s with unknown health conditions. And as always, our sympathies go out to those families. For state totals, we are at 361,260 tests that have been performed, with 68,232 positive test results, which is an increase of 2,270 from yesterday. And we are at 2,974 deaths today for the state, which is an increase of 136 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we have 53 patients that are currently hospitalized due to COVID-related reasons, and 5 of them are on ventilators. For the congregate living facilities that are in St. Clair County that are currently in outbreak status, and that is simply 2 combination of staff or residents that are either positive COVID or they do have COVID-like symptoms. The first is Berea of Belleville with 20 cases and 2 deaths. Berea of Cahokia with 5 cases and no deaths. Caritas Family Solutions in Belleville with 6 cases and no deaths. Colonnade in O'Fallon with 3 cases and no deaths. 4 Fountains in Belleville with 63 cases and 13 deaths. Help at Home in O'Fallon with 5 cases and no deaths. Lebanon Care Center in Lebanon with 34 cases and 5 deaths. Memorial Care Center in Belleville with 43 cases and 5 deaths. St. Paul's Home in Belleville with 5 cases and 1 death. And TDL Incorporated in Belleville with 4 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So on our zip codes today, we have both a 1 going down, which is because we've always said that these reports can be revised, and many going up, so we'll go through those now. 62201 now has 12, and that is a decrease of 1. 62203, there are now 24, that is an increase of 2. 62204, there are 32, that is an increase of 2. 62205, we now have 26 COVID positive diagnoses in that zip code, and that's an increase of 2. 62206, there are now 57, that is an increase of 4. 62207, there are 33, that is an increase of 3. 62208, we remain at 37. 62220, there are now 59, that is an increase of 1. 62221, there are 46, that is an increase of 1. 62223, there are 38, that is an increase of 2. 62226, there are 79, that is an increase of 3. 62232, we remain static at 7. 62239, there are now 10, that is an increase of 1. 62254, there are 18. 62257, there are 7. And 62258, we remain at 14. 62269, there are now 52, that is an increase of 2. And in 62285, we remain at 6. So going through the numbers that we reported today, there are a couple bright spots. You heard Dr. Bodeman yesterday talk about fewer people being on ventilators. And today, not only have the number on ventilators gone down, but also the number of COVID-19 patients in our hospitals has gone down by 7. So we like those numbers. We're going to continue. That is, of course, just a snapshot of today, but I think it's certainly a good sign for today. Another good sign is that we've said all along that the only way we're going to get through COVID-19 is testing, testing, testing. And today's numbers show that we tested over 250 people since yesterday. So that number is a big number. Those are people now that we can track and trace and start to get a hold of these numbers. And from my reading, it's pretty close to the number we need to do every day to make sure that we get through this and that we're tracking and tracing enough people to be able to get this virus out of our system, or at least out of our county system. Part of the reason why we're being able to test so many is that we've opened up a number of testing sites. And today, joining us, we have Captain Robert Monroe. The captain is with the Illinois Air National Guard. He is the officer in charge of the state test site at the Jackie Joyner Kersey Center. Welcome.
Hi, glad to be here.
So, Captain, let's just talk a little bit. You're a local hero. Talk about where you're from, Mascoutah.
Yeah, so I grew up in Mascoutah, and while I've kind of been all over, I'm now a teacher, and I live in Fairview Heights. And so I teach at Pontiac Junior High. I teach 6th, 7th, and 8th graders literature and composition when I'm on the civilian side.
So you got double duty. You're right now you have stood up this new testing site at the Jackie Joyner Kersey Center, but you still have a class or many classes of kids that are counting on you. How do you juggle that?
You know, at the beginning, when you're opening a site, it takes up a lot of your time. So I had a little bit of foresight, so I was able to go ahead and get the majority of my assignments out there and set it up so that a lot of it could be graded electronically for me. But the students still need, for us to contact them and answer questions. So usually when I get back at the end of the night, take a shower, and then I spend the next maybe 45 minutes or an hour kind of working through that.
And that's the job of a guardsman, huh?
Yeah,
That's your double duty.
Yeah, citizen soldier.
So let's talk about your testing site. So you stood this up. Let's talk about the timeline. When did you start on this, and when did you start testing the public, in full passion? And
Okay.
When was that?
So, I was notified early last week, and sorry, that's actually my report. I don't have to.
Well,
There's no turning that off.
fresh off the press.
I got a lot to take care of. But so we started early last week. That's when I was notified, and then I think it was Wednesday. I was able to go in, started to get organized. Thursday, I received my airmen. So we have 30 from the 126 here at Scott and 30 from the 183rd in Springfield, and we have a hotel where we're quarantined. And that's when we started to visit the site, and then we started to set it up and started getting our training. And then we actually had our first open day today, where we received both vehicles and walk-ups for testing.
So how many people so what's your capacity, and how many people came on the first day?
Okay, so we have right now have the capability to test 500 people a day. And I think by the time I left, we started a little bit slower in the morning, and it picked up progressively throughout the afternoon, and we had well over 100 by the time I left to come over here. But we do anticipate high numbers, and we're really hoping to meet those 500 tests a day.
So you got plenty of signage. I think we ought to, just for people that are curious where this is, the Jackie Joyner Kersey Center is well known to many in East St. Louis. It's off of Interstate 64, 25th Street. There's a lot of signage that says Jackie Joyner Center. Once they get off at the exit, IDOT's put up a lot of signs. So once a person's there, let's go through what's the process. If you're driving, first of all, how are they going to access the site?
Sure, I'll start with the driving process. It's really simple. It's easy to get there, and then once you do get into the site, you're just going to make your way there to the tent in line, and then they're going to ask you for some information, and then they're going to ask you to roll your window down just an inch or so.
So you never leave your car?
You never leave your car. Usually you're rolling your window down maybe an inch, inch and a half. They give you the testing stuff, and they've already taken all of your information. And then you take, it's very similar to a Q-tip, and then you take that and you just swab it around the opening of your nostril. It's not scary, it doesn't hurt, it doesn't go far back into your nostril. It just swabs for 15 seconds on each nostril, and you put it in a vial, and you put it in a bag. We seal all that up, goes in another bag, and then it's shipped to the lab. And then you just roll your window up, and you'll receive a call in 48 hours to a week.
So did anyone get turned away today?
So we had a couple people that kind of came just to look. So when someone comes, one of the key things that we look for is that they're demonstrating some type of symptom that would make them require a test. And so the guard never turns away anyone. Everything is run, for that particular side of it, is run through the Illinois Department of Public Health. And so if the Illinois Department of Public Health has screened them and let them in, then they're going to be tested.
And I think Illinois Department of Public Health has loosened up those guidelines. Their goal is to test 500 a day. If that's the capacity, they want people to come there. And so I think there are some criteria, but pretty well they're telling people come there. If you feel you need a test, there may be a reason for that.
Yeah, if you feel that you've been infected, or you're having symptoms, or you have underlying conditions, or you're an essential worker or an emergency worker, you have some worries, then you should come get screened.
Have you had any walk-in customers?
We have had a few walk-in customers. It's been a little bit slower on that side than the drive-through side, but it is brand new. We are the first state-facilitated walk-through testing site in the state, and so it's people just aren't quite used to that yet. But it's a great, safe, easy process, and we're really hoping that it catches on.
And it's right on the Metrolink route. So there's a station close by where people could actually, if they don't have transportation, this is a way that they can get to a testing site, short walk from the station,
Mm-hmm.
and then they're brought in much in the same process as a person who drives.
Yes, it's really important that anyone that feels that they're having symptoms have the opportunity to get tested. And so just because you don't have a personal vehicle, it's not really fair that you can't be tested. So that's what makes this particular site so unique. So this is really, truly a testing site for anyone. And it is very easy and very simple. But there are a couple rules. We do need you to wear a mask. And so those that were turned away, for the most part, they did not have a mask on.
So people are required to wear a mask on metro trains anyway. So if they're coming that way, hopefully they'll have it on. But that's a good thing. What are the hours that you run this?
So we're currently running 0800 for all of you military people out there, but just 8 o'clock till 4 o'clock. And but there is a caveat to that, and that is if we're really packed, which we expect, when we run out of our 500 tests for that day, then we do have to shut down because that is the lab's capacity.
And then at 4 o'clock, you're also driving those tests to Carbondale to be tested. So every day you've got a schedule you got to meet because it's going to take all night for those tests to come back. Or
Yeah, that's right.
And maybe as much as 48 hours, you said?
We've seen results in as quick as 48 hours.
Okay. Great. Well, we appreciate you taking on. I don't know that when you signed up for the Guard that you thought the pandemic was in your future, but we appreciate you making a big difference because only, as we said, only with testing are we going to be able to solve this issue. Herb Simmons?
Yes, a couple of things. You have to have an ID required, is that correct?
So it's not necessarily required, but we do encourage you to have an ID. They're going to have minors that don't have that, and as long as they can give themselves the test themselves, then they can come and be tested as well.
And it's free?
It is completely free. You don't need insurance for it. All you need to do is show up and have that ID and mask on, and if you're displaying the symptoms and IDPH feels that you're good to go, you'll be tested.
And I received an email this morning, I think it was, that the National Guard has taken all the precautions like they always do. If somebody would happen to show up on there and become extremely ill, they've even got EMS on site there. I got that email this morning, so I was glad to hear that. But as the chairman said, I really appreciate you taking the time from coming up here to give our followers on our briefing the insight of what that, and hopefully they'll take advantage of it. There's no reason why they shouldn't.
Yeah, I hope so.
Very good. Thank you very much.
Yeah, thanks for having me.
Thank you, Captain. Thanks for being here.
Good. Back on the EMA side, held a conference call with the Illinois Department of Public Health today. Also received another shipment of the PPEs in. While that was being done, we had 31 of our first responding agencies come this afternoon to pick up those PPEs, which they were grateful for that. The other thing I just wanted to throw out there, this is actually a Nurses and Teachers Appreciation Week, and our hats go off to especially all of those nurses for what they've been doing, and of course the teachers. You just heard the captain who is doing double duties as a teacher and in the National Guard, and we wanted to bring the National Guard in to show you that this is serious, this is real. They came in with their mask on. I'm seeing a lot more people out there doing that, so that's the good thing, because that's what we need to be doing to protect all of us. You heard the numbers from Sam today, statewide, another 136 deaths around the state of Illinois, 2 more here in our county. We keep telling you that, and trust us, that day is going to come when Sam is going to walk in here and say, guess what? No new cases, and we can't wait for that to happen. We'll see you tomorrow afternoon at 3:30 for our next briefing. We'll be back momentarily with our young ladies to translate this into our Spanish communities. Thank you very much.